If there was a safe treatment that could prevent a fifth of premature deaths globally, we would jump on it. And there actually is: healthy diets and food. A majority of Canadians have a suboptimal diet, and rising rates of related conditions such as type 2 diabetes have persisted over the past decade. Unfortunately, we have seen that it has been notoriously difficult to change the behavior of individuals to improve their eating habits. Environments and neighborhoods have often been the way to go to create meaningful improvements in population health, and neighborhoods with limited access to healthier food options or easier access to less healthy food options may put their residents at risk for poor diet and chronic disease. My doctoral thesis aims to determine how food environments are associated with diet and health outcomes by leveraging three Statistics Canada datasets. First, I'm using the Business Register, which is a full repository of businesses in Canada. This data allows me to identify, locate, and classify food outlets in Canada to calculate and map my food environment measures. The main advantage of the Business Register is that food outlet information comes from mandatory tax data, making it highly accurate. We're calling the final dataset CanFed, or the Canadian Food Environment Dataset, and we aim to make it available through the Research Data Center network. This way, other researchers can link it to any survey data that they wish. We also aim to make a more general and easy-to-use version of the dataset that can be made public. Second, I will link my food environment measures to participants of the 2015 Canadian Community Health Survey Nutrition. This survey has rich diet information and food security data from a large sample of Canadians. Then I will link my food environment measures to participants of 5 waves of the Canadian Health Measure Survey. And the main advantages of this survey is that measures were collected from a large sample of Canadians at mobile clinics that were actually set up around the country, meaning that we don't have to rely on self-reports of health, which can introduce bias. Alongside this work, I am auditing 5 purposefully selected neighborhoods yearly in the Greater Montreal area. This will help determine how much neighborhoods and food outlets change through time, and also reveal how COVID-19 is changing food environments. My thesis will provide the first pan-Canadian dataset of neighborhood food environment measures that will be available for other researchers. These measures should also prove useful to public health communities in Canada who may wish to create and monitor food environment interventions. Many Canadians live in neighborhoods that are swamped with unhealthy food options and offer limited healthy options. By linking the data from these 3 surveys, my research will inform to what extent the food environment determines what Canadians eat, and to what extent food environments get under the skin to affect the health of Canadians.